We continue with Zhang organs, part 2 of spleen. Governing ascent of the clear. Ascent refers to the upgoing motion of spleen qi, while the clear means the essential substances, including qi and blood. There are two aspects of the spleen function of governing ascent of the clear. The spleen qi goes upward and transports the essence up to the heart, lung, head, and eyes, as well as to nourish the whole body. When the spleen functions soundly, its qi goes up normally and the essence is absorbed and distributed normally. Therefore, qi, blood, and body fluids will be abundant. If the spleen qi fails to ascend the clear and also fails to transform and transport the food, the essence cannot be absorbed or distributed, resulting in the deficiency of qi and blood. Therefore, symptoms of listlessness, dizziness, abdominal distension, and diarrhea may appear. The doctors often associate the theory of spleen's function of ascending the clear with the viscera position. If spleen qi fails to ascend or conversely sinks down, symptoms of chronic diarrhea and prolapse of the anus, stomach, and kidney will appear. The spleen can keep blood circulating within the vessels, preventing extravasation. Spleen qi plays an important role in this function. The main mechanism is actually the controlling action of qi. When the function of spleen is normal in transforming and transporting, qi and blood will be abundant. Qi will keep blood circulating within the vessels and prevent extravasation. On the contrary, when the function of spleen is abnormal in transforming and transporting, it will lead to shortage of the source for generating qi and blood. Qi deficiency can no longer control the blood circulation, and the blood may extravasate from inside of the vessels, thus resulting in bleeding. This is called syndrome of spleen failing to control the blood. It may lead to various kinds of bleeding of the lower parts of the body, such as bloody stool, uterine bleeding, and purpura. The spleen's governing transportation and transformation is the most important among the three functions. If the spleen qi is abundant, transportation and transformation will be normal, qi and blood will be abundant, 5 Zhang organs will be nourished, and the functions of ascending the clear and keeping blood circulating within the vessels will be in order. Now let's go to systemic relationships of the spleen. The spleen is related to the muscle and body constituent and dominates the 4 limbs. The spleen and stomach are the sources of qi and blood. Only when nourished by the essence, which is transformed and transported by spleen and stomach, can the muscles be healthy. The strength of the muscles depends on the transforming and transporting functions of the spleen and stomach. When the digestive function of the spleen and stomach is normal, qi and blood will be abundant and the muscles will be strong. If the spleen and stomach are weak, qi and blood are deficient, leading to thin, weak, and atrophic muscles. 4 limbs are the major tissues for sports. The 4 limbs demand the nutrition of essence, being transformed and transported by spleen and stomach. The transportation of essence also depends upon ascending the clear of spleen qi. Therefore, the 4 limbs are related to the functions of governing transportation and transformation, as well as ascent of the clear. If there is dysfunction of spleen in transportation and transformation, there will be scarce supply of nutriment to the limbs, and limbs will be tired and flaccid, resulting even in atrophy. In treating chronic spleen stomach disease characterized by weight loss or fatigue, the spleen and stomach should be invigorated and qi and blood should be replenished. The spleen opens into the mouth and shines at the lips. The spleen opens into the mouth means that diet and appetite are closely related to transforming and transporting functions of the spleen and stomach. If the spleen and stomach transport food normally, the appetite and diet will be normal. Otherwise, a tasteless, sweet, or bitter taste may appear. The color of the mouth and lips indicates whether qi and blood are sufficient. As the spleen and stomach are the resources of qi and blood, whether the mouth and lips are red or moist not only reflects the state of qi and blood, but also reflects the transporting and digesting functions of the spleen and stomach. The spleen corresponds to thinking and emotion. Thinking is one kind of emotion related to spleen. The normal thinking is not harmful to the body, but overthinking will influence the body's normal activities and cause the qi stagnation. Ascending of the spleen and descending of the stomach is the pivot for qi movement. When qi is congested, the transportation and transformation gets upset, and the action of sending up the clear is impaired, leading to anorexia, epigastric distension, and even dizziness and vertigo. Saliva is the fluid of the spleen. Saliva is the thin and clear part of the natural liquid in the mouth. It plays the role of protecting the oral mucosa and moistening the oral cavity. Saliva is secreted when one is taking in food, making it easier to be swallowed and digested. Under normal conditions, saliva is secreted into the mouth without spillage. If the spleen qi is deficient and fails to control the fluid, spillage will occur. Thus, spleen must be treated. Thank you so much for listening.
Let's discuss interviewing the ears. The two organs that have the greatest impact on the ears are the kidney and the liver. Kidney Jing and kidney Yin nourish the ears, while the liver has influence on them because liver Yang imbalances can ascend to the ears via the gallbladder channel and disturb their functioning. The ears can also be directly and indirectly invaded by exogenous pathogenic qi. In particular, wind heat can directly invade the ear, as well as the Sanjiao channel. Invasions of exogenous pathogenic qi will cause pain and exudation of yellowish discharge from the ear. Invasion can also result in tinnitus with a loud sound or deafness. Because the condition is due to an acute invasion of exogenous pathogenic qi, the symptoms will arise suddenly. It will typically be only one of the ears that is affected. Kidney Jing deficiency or kidney yin deficiency can indicate that the ear lacks nourishment, meaning that the ear will not perform its function optimally. Typical symptoms that may be due to kidney Jing deficiency or kidney yin deficiency are deafness and tinnitus. Tinnitus due to a deficiency condition will typically manifest with a constant low tone and will be exacerbated by fatigue. If the tinnitus is alleviated by sticking fingers into the ear or pressing on ears, this is a sign of kidney deficiency condition. Tinnitus resulting from ascendant liver yang or liver fire will be louder and will vary in strength. The tinnitus will also be adversely affected by the stress and emotional influences. Liver excess tinnitus can also be exacerbated by sticking the fingers in the ears. It will often have arisen suddenly, whereas kidney deficiency tinnitus will have developed gradually. These are general guidelines and is actually most common that there are aspects of both. This is because kidney and liver yin have a common root and the liver yin deficiency can result in ascending liver yang. Tinnitus that is worst at night is a sign of yin deficiency or blood stagnation. It is important to note that the tinnitus may not actually be louder at night, but because there is less noise in the room, it is more noticeable. Tinnitus that has arisen from exposure to loud noise will be classified as blood stagnation. Deafness and hearing difficulties will often be due to kidney yin deficiency or kidney jing deficiency not nourishing the ear. However, a sudden loss or decrease in hearing will be due to an invasion of wind heat or ascending liver yang. An increased production of earwax is usually due to liver and gallbladder damp heat. The exudation will be very sticky. Spleen and kidney yang deficiency can also result in an increase in earwax, but it will be thinner and more watery. Phlegm and dampness will in general result in increased and thicker exudations from the body's orifices. This also applies to the ears. Liver and gallbladder damp heat or toxic fire can result in the formation of increased exudate in the middle ear. There will be pain and possibly yellowish discharge from the ear. Earache can also be seen in invasion of wind heat, liver fire imbalances, and when there is a local stagnation of qi and blood. Ears that are itchy may be due to invasion of wind heat, gallbladder damp heat, liver blood deficiency, generating internal wind, or kidney yin deficiency, heat. So we have here the table for the observation, tinnitus with a loud voice or loud rushing sound. The significance is excess condition. Tinnitus with a low sound or faint rushing noise is a deficiency condition. Tinnitus that has arisen gradually is a kidney yin deficiency, kidney and liver yin deficiency, kidney yin deficiency. Tinnitus that has arisen suddenly, the significance is liver fire, ascending liver yang, invasion of wind, heat, blood stagnation. The poor hearing, the significance is kidney deficiency condition. Hearing impairment, which occurs suddenly, is a wind heat or ascending liver wind. Earache, the significance is wind heat, liver and gallbladder damp heat, blood and chi stagnation, ascending liver yang or liver fire. Otitis or exudation of yellow discharge from the ears, significance is wind heat, liver and gallbladder damp heat, toxic fire. For the itchy ears, the significance is wind heat, gallbladder damp heat, liver blood deficiency, which generates wind, or kidney yin deficiency heat. Increased production of earwax, the significance is phlegm, dampness, liver and gallbladder damp heat, kidney and spleen yang deficiency. Thank you for your attention.
Let's proceed to diagnosis according to pathogenic qi with the pattern food stagnation. Food stagnation is similar to blood stagnation and phlegm in that it is often overlooked. Food stagnation tends to be a contributory factor to the other imbalances rather than being a consequence of them. However, several imbalances can lead directly to food stagnation. As with qi or blood stagnation and phlegm, the symptoms and signs of food stagnation can be easily overlooked. This is because you have to ask about specific signs and symptoms that the client often does not even realize that they have or they do not see as relevant because it is something that they have always had and regard as being normal. Food stagnation can be seen on the tongue and in the pulse, but these signs are often overlooked because they get interpreted as dampness, phlegm, or qi stagnation. Food stagnation arises when food physically and energetically accumulates in the middle jaw. Food stagnation generally has two consequences that can lead to further imbalances and complications. Food stagnation can block the qi dynamic of the middle jaw, and it can create qi. By physically and energetically blocking qi in the middle jaw, food stagnation will disrupt and burden the stomach and spleen qi dynamic. This can lead to stomach and spleen qi deficiency, rebellious stomach qi, dampness, damp heat and phlegm. In addition, a blockage of qi in the middle jaw can disrupt the communication of qi between the lower and upper jaw and between the kidneys and the heart. Food stagnation can also disrupt liver qi in its spreading function. Heat will quickly arise as a consequence of food stagnation. This can initially lead to stomach fire and stomach qi deficiency and contribute to the creation of damp heat and phlegm heat. When food stagnates in the stomach, it will manifest with a turgid and distended sensation in the epigastric region. Food stagnation creates heat. At the same time, it blocks the stomach qi from descending. Both of these factors can cause the stomach qi to rebel. This can manifest as burping, heartburn, and acid regurgitation a while after eating. The belching will usually taste of the food that has been consumed and sometimes will also be accompanied by a small amount of semi-digested food. The disruption of the stomach and the spleen qi dynamic can result in nausea or poor appetite. When the food is stagnant, it will not be transformed properly and will instead have a tendency to rot and ferment. The combination of untransformed food and heat can also result in the stool being loose and sticky. The stool can also smell rotten like sewage. Food stagnation can cause constipation by stagnating qi in the stomach and the intestines. Food stagnation can manifest on the tongue with a thick, greasy coating in the middle of the tongue. The pulse will often be wiry and slippery in the middle or guan positions. So let's take a look at its etiology. Food stagnation can arise as an acute imbalance when too much food is consumed at one time, when food is eaten too frequently or too late in the evening, or when inappropriate food is eaten, that is, food that is difficult to transform. Food stagnation can also be a chronic condition due to spleen and stomach being too weak to be able to perform the respective functions. Dampness, phlegm, and liver qi stagnation can also be involved. In this case, even smaller amounts of food and even more types of food will result in food stagnation. The foundation for food stagnation can have been laid very early when the person was a baby due to the diet they were fed and the way they were fed. Many babies and toddlers are fed food that is too coarse and unrefined, is too sweet, creates dampness and phlegm, and is too cold. Moreover, many babies are often fed too frequently. This is problematic because the spleen is not capable of transporting and transforming optimally. This can lead to food stagnation, a subsequent weakening of the spleen, and the formation of dampness, heat, and phlegm. So let's go to the symptoms and signs. There will be stuffed or turgid sensation in the stomach after consuming food, abdominal distension after eating, discomfort after eating, loss of appetite, nausea, acid reflux, belching or burping with the taste of previously ingested food, hiccup, bad breath, loose stools with undigested food particles, constipation, stool smell rotten, thick, greasy coating in the middle of the tongue, and the pulse is slippery or wiry in one or both guan positions. The key symptoms, there will be a full sensation or discomfort in the epigastric region, belching that tastes previously ingested food, thick, greasy tongue coating. Treatment principle, disperse and dissolve food stagnation, tonify and regulate qi in the middle jaw. For the acupuncture points, we can choose from REN 11, REN 12, REN 13, REN 22, stomach 21, stomach 34, stomach 36, spleen 4, and pericardium 6. If there is heat, we can add LI 11 and stomach 44. We needle with draining or even method. So REN 11, REN 12, REN 13, REN 22, stomach 21, stomach 54, stomach 36, spleen 4, and pericardium 6 regulate the stomach qi and qi in the middle jaw. LI 11 and stomach 44 drain heat from the stomach and intestines. As a relevant advice, a person with food stagnation should avoid eating too quickly, too much at a time. As a relevant advice, a person with food stagnation should avoid eating too quickly, too much at a time, late in the evening, and foods that are difficult to transform. They must chew their food thoroughly. They will benefit from massaging their abdomen with light downward strokes from REN 16 down to REN 8 immediately after they have eaten. They can also massage the abdomen in a clockwise direction a few times throughout the day. As well as avoiding the consumption of foods that are difficult to transform, they will benefit from using aromatic herbs in their diet and possibly consuming a little bit of cardamom, aniseed, and other aromatic seeds immediately after they have eaten. This will help the stomach and spleen to move qi in the middle jaw. Food stagnation can be caused by the following patterns of imbalance: stomach and spleen qi deficiency, dampness, and qi stagnation. In turn, this can result to qi stagnation, heat, dampness, phlegm, spleen qi deficiency, stomach yin deficiency, and stomach fire. Thank you for your attention.
Diagnosis according to 4 levels. Lung heat. Lung heat, in addition to the symptoms and signs described above, heat will have damaged fluids in the lung and disrupted the lungs' qi. This will result in a loud barking cough because it is a qi condition. There will be sticky yellowish sputum that is difficult to expectorate. Breathing will be impaired because qi is blocking the lungs' ability to descend and spread qi. The blockage of qi will also result in chest pains. Etiology: exposure to exogenous qi that has either invaded the lung directly or penetrated down from the way level. Symptoms and signs: fever or feeling of heat with no aversion to cold. Cough with yellow sticky sputum that is difficult to expectorate. Profuse sweating, thirst, chest pain. Dyspnea, red face. Restlessness, restless sleep, red tongue with yellow coating, rapid pulse. Key symptoms are fever, cough with yellow sticky sputum, thirst, rapid pulse. The treatment principle would be to drain heat from the lung and regulate lung qi. The acupuncture points to choose from would be lung 1, lung 5, lung 10, lung 11, LI 11, DO 14, and UB 13. Needling technique would be to drain, possibly bleed DO 14. Explanation: lung 1, lung 5, and UB 13 drain heat from the lung and regulate lung qi. Lung 10 and lung 11 drain heat from the lung. DO 14 and LI 11 drain qi level heat. Relevant advice: the person should avoid consuming food and beverages that will create additional heat in the body. Cigarette smoking is not recommended because it will create heat and phlegm in the lung. Lung heat can also be caused by the following pattern of imbalance. Way level heat. Lung heat can result in the following patterns of imbalance: yin level heat, shui level heat, phlegm heat in the lung yin shu. Thank you for your attention.
Let's discuss combining points principles, balancing left and right. Sometimes unilateral needling is used with the connecting points. These are often used on the opposite side to the disease side in chronic conditions when the channel is in a deficient state. Interiorly related channel will achieve the effect of balancing the left and right side of the channel. For example, if we are treating a chronic pain of the arm along the large intestine channel and the channel on the disease side is in an empty condition, manifested by dull ache and slight wasting of the muscles, we could use lung 7 on the healthy side with reducing or even method to balance left and right and shift qi from healthy to the diseased side. The use of the opening and coupled points of the extraordinary vessels is, of course, a good example of the use of unilateral needling and balancing of left and right. Extraordinary vessels, the directing vessel in yin is lung 7, and the associated point is kidney 6. The yin stepping vessel is kidney 6, and the associated point is lung 7. And the governing vessel is SI3, and the associated point is bladder 62. Yang stepping vessel, the opening point is bladder 62, and the associated point is SI3. The penetrating vessel, the opening point is spleen 4, associated point is pericardium 6. And yin linking vessel is the opening point is pericardium 6, and associated point is spleen 4. The girdle vessel, opening point is gallbladder 41, and the associated point is triple burner 5. The yang linking vessel, the opening point is triple burner 5 and gallbladder 41. Examples of crossover unilateral needling: pericardium 6 and liver 3 move qi, calm the mind, settle the ethereal soul. Pericardium 6 and stomach 40 is for full patterns of the stomach to calm the mind and open the chest. Triple burner 5 and gallbladder 43 for lesser yang headaches, and triple burner 6 and gallbladder 41 for breath problems. Triple burner 6 and gallbladder 31 expel wind, heat, and skin diseases. Li4 and stomach 36 harmonize the rising and descending of qi and regulate digestion. Large intestine 4 and stomach 44 harmonize the rising and descending of qi and clear stomach heat. Heart 7 and liver 3 calm the mind and settle the ethereal soul. Thank you for your attention.
Diagnosis according to Zhang Fu organ patterns. We discuss etiology of spleen imbalances. The spleen and its partner organ, the stomach, are located in the middle of the body, both physically and energetically. Physically, the spleen and stomach occupy the middle jaw, which means that they are the central axle around which everything revolves. All movement of qi, blood, and fluids, and all communication between the body's lower and upper jaw have to pass through the middle jaw. The spleen sends its qi upwards and the stomach its qi downwards. If this mechanism is disrupted or gets blocked, it will have implications for the movement and communication of qi, blood, and fluids throughout the whole body. For example, the small intestine and large intestine are completely dependent on the stomach and spleen qi mechanism, and organs such as the lung are also dependent on the spleen, sending qi and qinye up to it. If the spleen is not able to perform its functions of transforming and transporting as it should, dampness will arise. Initially, the dampness will accumulate and stagnate in the middle jaw. This will inhibit the movement of qi through the middle jaw and can thus interfere with the functioning of many other organs, as well as their central role in the movement and transport of vital substances. The stomach and spleen, together with the kidneys and lung, are fundamental in the production of qi, blood, and qinye. The spleen transforms the food and beverages that are ingested, separating the pure qi aspects from the impure. The spleen then sends these pure aspects upwards to the upper jaw, while its partner organ, the stomach, sends the remaining dregs downwards for further transformation and finally expulsion from the body. If the spleen is weak, there will only be a limited production of qi, blood, and qinye. This will affect the whole body and all the other organs, as well as the movement, transformation, and transportation of these substances. It is said that the spleen detests dampness and that it prefers dryness. This means that the spleen's qi mechanism is easily disrupted when there is dampness. The dampness can be exogenous or it can be internally generated. Invasions of exogenous dampness are usually due to climatic influences, such as when a person spends time in a damp environment or is exposed to wet, humid weather. Invasions of exogenous dampness have traditionally been a major etiological factor in northwestern Europe because this area has a cold and humid climate. In the old days, these etiological factors were even more predominant due to poorer standards of housing. At the same time, a greater proportion of the population was employed in occupations where they were more exposed to the elements. Exogenous dampness is, however, still a problem, despite the improvement in housing and changes in the labor market. This is because the air is still generally quite damp and humid, and people are exposed to the elements when cycling, walking, jogging, and so on. It is therefore important that people are properly dressed and that they quickly change into dry clothes if they get wet. Dampness can enter the body through the legs in channels, so people, especially women, should ensure that they are adequately clothed on their legs and wear appropriate footwear when it is cold and damp. Furthermore, living in buildings that have fungal infections, such as dry rot, can provoke or generate symptoms of dampness in some clients. Mold and other fungi will therefore often be considered to be a form of exogenous dampness. Dampness can also be internally generated. This will occur because there is spleen qi deficiency, and the spleen is unable to transform the food and liquids that have been consumed. The resulting dampness will then in itself further burden the spleen. Dampness can also arise from excessive consumption of foods and beverages that have a damp nature, such as dairy products, sweets, sugar, bananas, beer, and wheat flour. One of the tasks that spleen yang performs is that of transformation and transportation. If there is an excessive consumption of food and beverages that are cold, either in their energetic dynamic or in their temperature, this will strain the spleen yang. Therefore, an immoderate consumption of raw vegetables, salad, fruit, cold water, ice cream, and so on can have a negative effect on the spleen. It is especially detrimental for the spleen yang if cold water is drunk with meals. In general, the diet and the way it is eaten is the single most important factor in the development of spleen-related imbalances. People often eat and drink products that are too cold, both energetically and in their temperature. Things that are too sweet or foods that in themselves create dampness and phlegm. They eat food that is too coarse and raw. They eat too quickly, too much at a time, late at night, and food that is of poor quality. The tendency to have spleen chi deficiency and phlegm dampness is often initiated in the first years of a person's life. Giving a baby or a toddler the wrong diet or feeding them incorrectly can easily burden and weaken the spleen, which is not fully developed and therefore vulnerable. This will create a fundamental tendency to have spleen chi deficiency and for dampness and phlegm to form, which further compromises the spleen chi, creating a vicious circle. Although eating too much, too fast, and too late are often cited as causes of spleen and stomach imbalances, it is important to remember that eating too little will also damage spleen chi. Malnutrition due to starvation and hunger is not as big a problem in Northwestern Europe as it was historically. Nevertheless, it is still a problem when someone has an eating disorder, eats a strict diet, or eats a very one-sided diet. Furthermore, some people eat too much, but the food they eat is of very poor quality. All of these factors can lead to spleen chi deficiency. Unfortunately, many people who are overweight and go on strict diets quickly put on weight when they start eating normally again. This is because the strict diet will have weakened their stomach and spleen chi, and thereby led to the creation of dampness and phlegm. Patients who have a history of anorexia and bulimia will often have seriously damaged their spleen and stomach chi. This is due to the extreme malnutrition that is a consequence of their disorder, fundamentally weakening their spleen and stomach chi, but also the repeated and forced vomiting will disrupt the stomach and spleen chi mechanism, and these organs then have difficulty sending their chi in the right direction. Some forms of pharmaceutical medicine, for example, antibiotics, have a very cooling and damp-producing energy. The use of these medicines can therefore injure spleen yang. Spleen yang is supported by kidney yang and mingmen, but if these are weak, spleen yang will also become weakened and will not be able to fulfill its functions in relation to the transformation and transportation of qi and fluids in the body. If the spleen and stomach chi mechanism is to function optimally, it is important physically that there is an open passage through which qi can be sent up and down from the middle jaw. If the person sits with a twisted midriff or sits slouched and slumped in a chair, it will physically block the movement of qi. Physical activity and exercise help to support the circulation of qi in the middle jaw. Therefore, a person who leads a very sedentary life will tend towards having a stagnation of qi in the middle jaw. Worry, speculation, thinking too much, and studying can bind and stagnate the spleen's qi. This can lead to a weakening of the spleen qi. If a person reads, watches television, writes on the computer, surfs the internet, and so on, while they eat, it will weaken the spleen qi. This is because the spleen must use its qi to digest or separate the pure from the impure, both intellectually and physically. In general, studying and reading too much strains spleen qi and can lead to spleen qi deficiency. Chronic illnesses, physical overexertion of the body, and heavy bleeding or hemorrhaging can lead to spleen qi deficiency. This is because the spleen will have to overwork to create sufficient Ku qi to replenish the chronic deficiency condition. Thank you so much for your attention.
Let's discuss diagnosis according to Qi, Sui, Jinye imbalances. The Sui heat. Blood heat can arise when exogenous pathogenic Qi invades the body and penetrates into the interior, or it can be internally generated. Like blood stagnation, blood heat will manifest with symptoms and signs that indicate that blood has lost its physiological properties and now has a pathological influence on the body. One of the main negative effects that heat in general has is that it agitates blood. This can cause blood to become frenetic and rupture the walls of the vessels, resulting in bleeding. Bleeding anywhere in the body can be due to blood heat, but it is especially prominent in heavy and prolonged menstrual bleeding or bleeding mid-cycle. The menstrual blood will be bright red in color, sticky, and usually with fresh, shiny clots because it is heat that is causing blood to stagnate. Blood normally anchors and nourishes Shen. If there is blood heat, Shen becomes agitated. This will manifest as mental restlessness, irascibility, and insomnia. If blood heat is more extreme, there can be manic behavior, delirium, or even coma. Many skin disorders are a direct result of blood heat, or blood heat is a major contributing factor. This is because blood should nourish and moisten the skin. If there is blood heat, blood will no longer be able to perform these functions, and it will instead negatively affect the skin. This can be seen in skin disorders where the skin is dry, red, and swollen and feels hot to the touch. The heat can generate wind. This will cause the skin to be itchy. Blood heat in common with other forms of excess heat can manifest with sensation of heat in the body, fever, or an aversion to heat. When there is invasion of pathogenic Qi that have penetrated into interior, the sensation of heat or fever will be worse at night because the yin aspect of the body is injured. Blood heat will also cause person to be thirsty because the heat endures and desiccates the fluid in the body. The tongue will be red and the pulse will be rapid. For the etiology, blood heat can arise when a person with exogenous heat penetrates from the exterior aspect of the body down to the jing or blood level in the 4 levels. There can also be a residue from previous invasion of pathogenic Qi that had been expelled from the body or from the vaccinations. These residues or residual pathogenic Qi can generate heat in the blood. The liver is a reservoir for blood. If the liver is hot, it will cause blood to become hot. This means that factors such as consumption of food and beverages that are energetically hot, particularly alcohol and emotional imbalance, can be contributing factors. Symptoms and signs: there is skin disorders where the skin is red, hot, dry, swollen, or itchy. There's bleeding, short menstrual cycle, prolonged menstrual bleeding or mid-cycle bleeding, heavy menstrual bleeding, menstrual blood that is bright red, sticky and possibly clotted. Mental restlessness, mania or delirium, coma. Insomnia, fever, which may be worse at night, aversion to heat, thirst, red facial color, red tongue, rapid pulse. Key symptoms is red complexion, bleeding, bright red menstrual blood, mental restlessness, and rapid pulse. For the treatment principle, we have to drain blood heat. Acupuncture points use UB 17, UB 18, UB 40, Do 14, spleen 10, LI 11, liver 2, pericardium 3. Needle technique is draining, bleed UB 40, pericardium 3, and do 14. Explanation, UB 17, UB 18, UB 40, do 14, spleen 10, LI 11, liver 2, and pericardium 3 all drain blood heat. Blood heat can be caused by the following pattern of imbalance: invasion of exogenous pathogenic qi, liver fire, stomach fire, heart fire. Blood heat can result in the following pattern: liver fire, stomach fire, heart fire, yin deficiency, blood stagnation, blood loss. Thank you for your attention.
Let's continue to study depression with case history number 8 and 9. Our first case is a 37-year-old woman who had been suffering from depression for 2 years after the birth of her 4th child. She had 4 children close together. She felt depressed and lacked any drive. She felt confused about her life aims and was torn between the desire to go back to work or to spend all the time at home to look after her children. She felt exhausted all the time with a desire to lie down. Her periods were regular and not painful, but she suffered from premenstrual tension manifesting with a pronounced irritability and an aggravation of her depression. Her tongue was slightly red on the sides but pale in general. Her pulse was weak and choppy. Diagnosis. Again, the tongue and pulse are crucial to the diagnosis. The choppy quality of the pulse and the pale color of the tongue indicate blood deficiency. The redness on the sides of the tongue indicates liver qi stagnation. There is also a spleen deficiency as evidenced by the tiredness and desire to lie down. Our next case is a 48-year-old woman who had been suffering from depression for over 10 years. Her life had been very difficult in this time, going through the loss of a child and a divorce. She felt depressed, extremely tired and sad, and was prone to crying. She was pale and spoke with a weak voice. She also suffered from backache, and on interrogation, it transpired that she felt easily hot and experienced a dry mouth at night. She had a feeling of constriction of the chest. Her tongue was pale but had a red tip. The coating was rootless. The pulse was weak on the right palm position and generally empty at the deep level. The diagnosis. There are symptoms of lung qi deficiency as manifested by the pale face, weak voice, tendency to crying, and weak pulse on the right front position. The feeling of constriction of the chest indicates some stagnation of lung qi. In emotional problems, this frequently accompanies a lung qi deficiency. Other symptoms indicate a kidney yin deficiency, as manifested by lower back ache, dry mouth at night, pulse empty at the deep level, and rootless tongue coating. The sadness and grief deriving from her loss and separation injured lung qi and kidney yin, resulting in depression and a restraint of the coming and going of the ethereal soul. The kidney deficiency involved a deficiency of the willpower or qi, and this caused her to lack drive and enthusiasm. Lung 9, lung 3, bladder 13, bladder 42, to tonify the lungs, soothe the corporeal soul, and lift the mood. You can also use REN 4, spleen 6, kidney 3 to nourish kidney yin. And bladder 23, bladder 52 to strengthen the willpower, and do 20 to lift mood. The combination of acupuncture and herbal medicine produced excellent results in a relatively short time. After 15 months of treatment, the patient felt very much more positive, did not cry, and looked forward to the future. Thank you for your attention.